Good morning. I'm Dr. Sielatycki. I work at Steamboat Orthopaedic and Spine Institute here in Steamboat Springs, Colorado. And I have a heavy emphasis and focus on motion-preserving technologies in the spine, both in the cervical and in the lumbar spine. Today I'm going to talk more about the lumbar disc replacement as an option. With this technique, we essentially go into the low back, take out diseased discs, and replace them with prosthetic discs. And the distinction between this and a fusion operation is that you're maintaining mobility. So when we take out a bad disc and do a fusion, those two vertebrae don't move anymore, and that can put strain on the other segments and lead to additional need for back surgeries. The disc replacements don't do that. They allow for the spine and the segments that we've worked on to continue moving and maintain a normal arc of motion throughout the low back. So from sitting to standing, the spine needs to move and accommodate your position based on how you're standing or sitting or running or twisting or whatever you're doing. The spine was designed to move. And so this technique allows us to maintain that mobility while still treating the source of pain. This option is something that a lot of patients unfortunately can't qualify for because of advanced arthritis in other parts of the back, facet disease or stenosis. So people with advanced degeneration may not benefit from a total disc replacement in the low back. But that being said, there are still a lot of patients that do stand to benefit from this over and above a fusion operation. And so we do offer that here in Steamboat. This is a technique that's been around actually for several decades. Started out in the 90s in Europe, and in the early 2000s started to gain a little bit of attention in the United States. It sort of fell by the wayside and fell out of favor for various reasons. Some of that being just surgeon comfort with the technology, and some of that being related to the fusion technologies and how those have been propagated over time. But as I said, motion preservation is a big part of what I do, and it's really a passion of mine for spine surgery. And so I'm always trying to find a way to avoid doing a fusion on somebody's back, and a lumbar disc replacement is a great way to do that. To access the disc, we do an abdominal approach. I actually have a surgeon here that works with me, a general surgeon that works with me and assists me with the exposure. So we go through the abdomen. We have to move the abdominal contents to the side. We expose the disc and essentially remove it, make sure the end plates are leveled up, and then we put in the artificial disc and then close it up. So one level disc replacement typically takes about an hour to an hour and a half. Most patients will stay one night in the hospital just for observation to make sure they don't have any anesthesia problems or anything like that. Although for local patients, if they are awake and moving and feel comfortable, it's also possible to go home the same day. I would say most on average would stay one night and head home the next day. The first couple of weeks are patients are feeling some soreness, maybe a little bit ginger in how they're moving, but that should quickly improve, and by that 6-week point, most people are off to the races. I will say this again, I say this in all my videos, to any patient out there who's been told that they need a spinal fusion, I would challenge you to push back on that and really understand why the fusion is necessary, and ask your surgeon about other options besides having your back fused. There may be a good option, and it might be that the treating surgeon isn't either comfortable with or familiar with those options. So always good to get a second opinion. And there are certain problems that still fusion is probably the best answer, but you want to make sure that you understand why you're having this fusion, and maybe get a couple of opinions on that to decide if that's really what's best for you.